What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. And I'm your regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Welcome, ladies and gentlemen. This is Exposé, brought to you by the Shepherd's Flock International Church, and I am your regular host, Tony Akinyemi. And our axiom is what we need is not more medication, but more education. And that's why we do this, so that people can be more informed, more enlightened, and they know their options, and they can make informed consent and informed decisions, informed choices. Because there are many options out there. Many people are not aware, so they are narrowed to one or two. But when you know many options, you are able to make the right choices and the right decisions. We started a series on medical systems in the month of May 2021, where we want our viewers to get to know about various medical systems out there. Most people are only familiar with allopathic medicine. Many people are not familiar with osteopathic medicine, homeopathic medicine, naturopathic medicine, chiropractic medicine, functional medicine, and what have you. We have given the basics in the last 2 or so episodes. Right now, what we're doing is to bring experts, to bring practitioners, to bring people who are actually doing it in their clinics, to come and share with us what exactly they are doing and what they are probably doing differently, and to get everyone to be aware of what is available to them. I got to know about Dr. John through a mutual friend, Dr. Sylvia Binder, who mentioned him to me as a Nigerian who was out there in the diaspora, who decided to come back to Nigeria to set up something so that Nigerians don't have to go abroad to go look for these kind of modalities. It's right available in country. And that's why I believe the name of his clinic is also called In Country. Now, you're welcome, Dr. John, to this program today, and thank you for availing us your time.
Thank you very much, Reverend Tony. To God be the glory for this opportunity. I'm very excited.
You're most welcome, sir. Now, I'll be asking you questions relating to your practice, your person and your practice, and to help our viewers to know what is available in Nigeria. First of all, where exactly in Nigeria are you based?
Well, we are located in Abuja, and the full address is 158 2nd Avenue, Aldenko Estate in Galadimawa, Abuja.
All right,
That's
good.
where located.
Thank you very much, and we want to appreciate you for bringing this back home so that we don't have to travel elsewhere to go get it. Where exactly were you before you came to Nigeria to set up?
Well, I was in the United States of America, where I lived for over 30 years.
Oh my.
Yes, in the United States. Worked for the United States Food and Drug Administration as
FDA.
well as FDA.
Wow.
As well as Novartis, pharmaceuticals.
Oh wow.
And after 30 years, I say it is really time to really head back, home. Because if we don't do it, no other person will come and do it for us. So that's why I came back home.
What a juggernaut you have here today. You work for the FDA, you work for Novartis. By the way, for our viewers in Nigeria, FDA is the American equivalent of our Nigerian NAFDAC, all right, who regulate our foods and drugs and what have you. And Dr. John has worked with the FDA in the USA and with Novartis. Novartis is a pharmaceutical company, I believe.
Yes, one of the global pharmaceutical companies, major global pharmaceutical companies.
Right.
Yes.
You're welcome. So can we have a little bit about your background? Who is Dr. John Tor? I hope I pronounced it correctly.
Very well, Tony. You know the way it goes there. And what I always tell people back home here, nobody asked me to say I should say my name again. So you know what I'm talking about.
Yeah.
But actually, first and foremost, Dr. John Tor is a God. Is a child of God. I am a believer, and
Praise God.
I give glory and honor to God for my life. Briefly, I received my training in Nigeria here as a veterinary surgeon at the
Right.
Madu Bello University Zaria. Then after that, I did practice veterinary medicine for quite some years. But driven by the passion that I needed to espouse and increase and improve on my skills, I went to the United States, went back to school, took a master's degree, then went up to the medical school and got trained in automolecular and functional medicine and earned my PhD in that.
I see.
That is after that, then I became qualified, to work for the United States Food and Drug Administration. And those of you who are familiar with that kind of a background, you become a real bait for the pharmaceutical companies, and that's
Right.
why, Novartis, you just they couldn't resist, getting me over. And why in Novartis, I was actually a study director and then a senior scientist. I had the privilege of participating. I was one of the principal investigators that developed, Coartem and also
Right.
developed, Diovan. These
Mm.
are two Novartis booster drugs. So I'm very, happy with that. So by way of training, and then background, that is my educational background, and this is what I've been able to do experience-wise. I must at this point mention that while I was being trained at Oregon Health and Sciences University, which is equivalent of the medical school, for my PhD in automolecular, and functional medicine, I met my present professional partner, Dr. Lantum, and this was as far back as 94. And
Right.
we promised ourselves that one day, even when we finish and worked in America, we will forego, the comfort of working and living in America and come back and do something on the continent. And that's what led to the birth of in-country Medcare. And as you rightly said, you don't have to travel abroad. We can do here. So I'm really very excited.
Thank you very much, Doctor. We are so honored to have you back in Nigeria doing what you are doing. And I'm just getting to know that you even have a background in veterinary medicine. By the way, there are two, specialties in medicine that I particularly have tremendous respect for. You want to know who those two special? I mean, what those two specialties are? one is
will be mine. Go ahead.
one of them is veterinary medicine. The other one is pediatrics. Pediatrics.
Wow.
You know why I have tremendous respect for those two specialties? Because
I'm against that. Our patients don't really talk, but we're
exactly,
able to
exactly. Your patients can't talk to you, but you have a way of figuring it out, and I think that is wonderful.
Right.
That's wonderful. I have tremendous respect for veterinary doctors, for pediatricians, because they can look at their patients. They have modalities to look at how to figure out what is going on and be able to help their patients. So we are honored to have you today. Now, you came to Nigeria to start in-country clinics.
Yes.
Definitely, you must have a vision. You must have a mission. What exactly was at the back of your mind, apart from just coming to Nigeria to set up? What would you consider the vision and the mission of In-Country Medicare Limited, IML?
Well, vision-wise, that we are out to establish and bring back what we have learned from America, lived and worked there with them, because back home, most people are not exposed to this kind of knowledge. And then the Americans or the British, the Germans, who are in the lead, even the Chinese in this area, will not come back to do it for us. So that became a strong vision and passion that let me come and do something, deliver services. Right. And our goal, if you look at our website, we said in-country was established to reduce the propensity for you to travel abroad for health reasons. By way of mission, we want to be the number one, and actually we're the number one because we're the specialist integrative center that has been registered by the Federal Capital Development Authority in Abuja. We've been given the status of a specialist, hospital, and that is what we are. So this combined clearly defines our vision and our mission. Our mission is actually to deliver services, state-of-the-art, first-class services to Nigerians. Things that they used to travel abroad to go and get, we brought it home in country for them here to see. Most people never heard about functional modalities like ozone therapy. Then you're talking about things like undermed. Then you have the other palliatives like exercise with oxygen therapy, which I know you must be definitely interested. Right. Then we have, oxygen bar. Right. So when you come to our center, you see those things that you used to travel and see abroad or do abroad, we have them right here.
Right. I have 1,001 questions in my head for you right now. I don't even know where to begin from. But first and foremost, let me ask this one. Do you have plans to open up your clinic in other geopolitical zones in Nigeria? For example, I mean, you're in Abuja at the center. Do you have plans for Lagos, for Port Harcourt, for Kano, things like that?
Definitely. We're looking at that, but that will really come with time. One of our greatest challenges, even in Abuja for now, where we started first, most people don't know about what we do. Right. And most people, if you ask them about integrative medicine or functional medicine or automolecular medicine, they have no idea. But we say that, look, disease is not when you are standing before a physician or a medical doctor, right, express symptoms. Disease had really started a long time ago. Yeah. And we always remind people, and I was going to start with this, that if you look at man is born to live and die. Right. How well you live and how soon you die depends on your lifestyle. Right. Actually, if you live right, we're supposed to live about 130 years. Right. In fact, life begins at 70. Lack of knowledge that the Bible says, my people perish. Right. So our center also participates in educational programs, just like you have given us this opportunity to tell and educate the public how they can live well. How, in fact, talking about that, let me just cross it over. Our services are in main categories. Right. You have immune boosting. Right. Then you have well-being and disease prevention. Right. Then we have management and disease reversal. Then we have anti-aging, medicine that we do here.
Yeah, I was going to come to that later to tell us the various services you render. But let's make progress. Okay. First and foremost, I want to ask, you mentioned the name of one Dr. Lantom as your partner at that time when you were introducing yourself. Who is Dr. Lantom and what is his or her specialty?
Thank you, Tony. Yeah. Dr. Lantom is actually a giant in the field of integrative medicine. Right. Lantom, by training, is a pharmacist. Okay. He is a medical doctor, what the Americans call MD. Right. He is also board certified in internal medicine. Dr. Lantom is certified in ozone therapy. Dr. Lantom is certified in anti-aging medicine. and Dr. Lantum is certified in integrative medicine, all from the United States. Back in the United States where she is based, but actually she's between United States. She's originally from Cameroon.
Oh,
So she's between, yes, from United States to her hometown of Douala, where she actually set up a similar practice in Douala that she manages. And then she also manages the practice in Nigeria. So her life is Cameroon, Nigeria, US. Back in the US, she practices in 3 states of of America. So she practices in Tennessee, Minnesota, and then Missouri. So she's a great, lady, and more than anything, she's very, very much committed to the African spirit.
Thank you so much. Well, we have quite a number of our viewers in Cameroon, incidentally. Some of them have even attended our institute, Rafa Institute of Healthy Living, to train, and they live in Cameroon, they practice in Cameroon. It would be nice if you can give the contact address in Cameroon for our Cameroon viewers to be able to touch base with Dr. Lantum.
Yes, in fact, Tony, Dr. Lantum, the Lantum family is like a trademark in Cameroon. Once you mention Lantum, they know. Her father, Professor Lantum, who is late, they just buried him a few weeks ago, was the founder of the medical school in Yaoundé. So he's known well once you mention name Lantum. And also, she is also, her mother is also a professor of English.
Great to know. I'm going to ask this question again. I want you to, you have a background in veterinary medicine. She has a background in pharmacy and medicine, as well as certifications in various other, modalities. Now, you as a veterinary doctor, how on earth did you cross over into human medicine? And how does your background in veterinary medicine help in human medicine? Now, I ask this because, you see, when it comes to medical science, anatomy is anatomy. Every human being is, the same thing. In animal science, it's a different ball game. The anatomy of a bird is different from that of a dog, and that of, so how has your background in veterinary medicine helped in crossing over? What advantages has it given you?
A French philosopher once said this, that between the human and animal medicine, there is no dividing line. Neither should there be. The knowledge gained constitutes the basis of all medicine. This is to say, due to ignorance, some people don't really know who a veterinary doctor is, the kind of training he has gone through. So once they hear the name veterinary, they say, oh, what is he doing? But if you go back, things like heart surgery, the first surgery, cardiac surgery, performed by a veterinary surgeon. And you go to America, you see that they have all come together, that they're working. In fact, the best, as you said, a veterinary surgeon is trained in all rounds. Then, with that kind of, background, it really had helped me, because a medical degree is a medical degree, period. One emphasizes on human beings, the other emphasizes on animals. If you look at the physiology of a dog, and that of human, and then that of primate, you have little variations, if not more similarities. Especially in this part of the world, we're not well educated and we don't appreciate that. But honestly, who I am and what I'm able to do today is because of my veterinary degree background. I was vastly, trained in the preclinical subjects of physiology, pathology, histology, mention it. Then, having practiced, then I went back and had the opportunity to go and be trained in a medical school where I earned my PhD in automolecular system. In fact, if you want to know, in the initial aspect of my training in the medical school, I had to take some classes with some medical students, things like CNS, or the Central Nervous System Pathophysiology.
Right.
Which is one of those subjects that once you go through, it is considered a rite of passage, for medical schools.
Right.
Then, after that, then I was exposed to, research, training. I did a postdoc in the medical school again, and then went over to FDA and did research, and then went over to Novartis and became involved in drug discovery and drug development. Precisely, I was in what we call the preclinical safety, section. This is animal studies, where all the drugs are tested before they are approved for the clinical trial.
Right.
So it's been a very wonderful experience, and I don't want to blow it out here, but it is very obvious that most people, when they listen to me talk, they say, but this guy say he's a veterinarian, but what is it? What is he talking? I mean, he talks like a medical. I just laugh. I said, look, in terms of research, and honestly, I appreciate the opportunity. During COVID-19, I made a significant, contributions with NGO, almost having programs, educating people, and that kind of thing. So my veterinary training provided a wonderful background. But now I'm into integrative medicine, and I think one of the few in this country that have actually established that field.
Thank you.
And
Thank you so much, Dr. John. You've been mentioning integrative medicine, functional medicine. I mean, some of our viewers may not be particularly familiar with what these terms are. Can you share some more light? What is integrative medicine? What is functional medicine?
Integrative medicine gives a holistic approach to human well-being and management of disease. What do I mean by holistic? Typically, if somebody went to the hospital and complained of, headache, the doctor or the physician first initial reaction is to think of analgesic or pain relievers that will knock off that headache. Mm-hmm. But in integrative medicine, let me tell you or educate our listeners, we don't rush into treating, pain, because pain is just a warning sign that something is wrong with the body.
That's right.
Yes, that is integrative medicine, and I will elaborate, further. But before I lose, track, let's talk about functional medicine.
Right.
Functional medicine now addresses disease or look at the disease at the cellular level. What were those initial events that led to the cell that, malfunctioning? There is a caveat that we say in both integrative and functional medicine that disease is nothing but decreased ability of the body cells to utilize oxygen. Okay. It is when the cells get the oxygen that they're able to produce the energy. Right. And just like we humans, the unit of life is the cell. Mm-hmm. If the cell lacks, energy, then the cellular function now start, failing. And that is, disease. If the cell cannot utilize, oxygen, which is actually taken into the mitochondria for production of what they call the ATP, right, which is the energy currency. Mm-hmm. Then disease all comes in. Now, when disease comes in, when the cell is not able to function properly as it should, it is when cells function, cells come together to form tissues, tissue come together to form organs come together to form, systems. Mm-hmm. Now, is when this cell is not able to function, then concurrently you have accumulation of toxins. When you have accumulation of toxins in the body, it further aggravates the inability of the body cells, to function, properly.
Right.
So the accumulation of toxins, that's why then you have exacerbated inflammation.
All right.
In integrative medicine, we say that inflammation is the hallmark of all diseases. Though commonly, inflammation should be good, but when it is chronic, then it becomes, a problem.
Yeah.
So you see that I have defined that, integrative medicine being holistic. Let me come back to it. When somebody comes to us and is complaining of the liver problem, we don't just focus only on looking at liver function tests and that kind of thing, but we do entire holistic, comprehensive laboratory, because the organs, they should not just be divided like that, because they're all interlocking and interwoven like this.
Right.
So when the heart starts failing, it could eventually lead to the failure of the kidneys.
Yeah.
You look at how the heart is working in terms of the biochemical changes that might have taken place, that we can see from comprehensive blood analysis. Then we look at how the kidney is functioning. We also look at the immune system, the immune status.
Right.
Then we look at the various systems together. That's why it's a holistic approach.
Right.
And with this, somebody came to us, and quite a number, not just somebody, came to us complaining of prostate. He felt that prostate was going to kill him.
Right.
But when we did comprehensive blood tests on him, we found out that he would have even died from diabetes before even the prostate.
Right.
His blood sugar level was just blown out of proportion.
Right.
His what we call the HbA1c was almost over 12. That is really yes. Luckily, it was still working. So we now had to focus on the diabetes, but at the same time, look at treat him all along synergistically. So there are modalities that we use in integrative medicine to achieve this holistic and functional approach. I can come into that, or we can go into that if you feel necessary.
Oh yeah, we will get there. We will take a short break right now. And then when we are back, we will continue this conversation. Please don't go away.
My name is Olanike Aladeshuyi, a graduate of Rafa Institute of Healthy Living, a school run by Reverend Tony Akinyemi, where we are taught how to take care of our health using basic healthy living principles. My coming into contact with the school has changed my life for the better. Prior to that time, I had been diagnosed of arthritis. I had pains all over me. I had difficulty in breathing. But since I decided to take the principles taught in the school seriously, and I followed them, I discovered that my health has improved. I am free of pain. My breathing has stabilized to such an extent that I can run a gym. Can you beat that? So, I want to invite you. Come, join us at Rafa Institute of Healthy Living. Let's learn together how to reverse supposedly irreversible diseases using nutrition and lifestyle. All are basic principles. Your life will not remain the same again.
Welcome back. This is Exposé, brought to you by the Shepherd's Flock International Church, and I'm your host, Tony Akinyemi. We are honored today to have Dr. John Tor on this program, a veterinary doctor, an integrative medical doctor, with his partners who are specialists in various other areas, a pharmacist, a medical doctor, a consultant, internal medicine, and certified in various modalities in ozone therapy and so on and so forth. A very wonderful team working together with a base in Abuja, Nigeria, where people can access all of these modalities in integrative medicine. Don't forget that we're dealing with medical systems, the various medical paradigms, and here we have many of the paradigms under one roof at in country. I want Dr. John to tell us a little bit about the major categories of the services available at IML in Abuja.
Okay, thanks, Reverend Tony. At IML, our number one service is immune boosting.
Right.
We are specialists in the combinations of the various micronutrients that goes towards boosting your immune system. But before I go, let me clarify.
Right.
Actually, you don't boost your immune system. That is an old term.
Okay.
Because when you boost the immune system, that's why we have problem with COVID-19. When the SARS-CoV-2 virus gets into the body, the body immune system gets boosted. It's kind of overreact, and that is what even ultimately kills. So what we
the cytokine storm, you mean?
Yeah, the cytokine storms are involved with the production of the various chemicals, compound, the interleukins. Then you're talking about the bradykinin.
Right.
Especially the interleukin 6 and interleukin 12 and 2, 4, those are the ones that actually kind of boost your immune system.
Right.
So we don't boost your immune, we want to help you immunomodulate the immune system.
That's right. Good.
So I think it is very important for me to say that if not, somebody goes to say, oh, we had Dr. John talk about immune boosting, and there is nothing like immune boosting. So that is it. But the second service is what we are into well-being. Remember, I'm using the term wellness is now an old term.
Right.
So we talk about well-being or longevity.
Right.
So you want to promote well-being and disease prevention. Mm-hmm. It is better for us to teach you how you can live the right life, eat the right food, take the right micronutrients so that your immune system will be up-regulated, and then thereby prevent any disease coming into you. Or worst case scenario, as we're talking about, COVID-19, when you are properly immunomodulated, even when the virus comes into your body, it will not take you to the stage of going into intensive care unit. Then the recovery time too, that you will recover from the virus, if you are well immunomodulated, is also shorter.
Right.
Then the third area of service is what we call disease management and disease reversal.
Right.
As you know very well, the disease process is very complex, especially take, for example, cancer. Cancer is a very nebulous, complex, motor system and motor organ failure of the body system. It's not, and when people look at cancer as a simple thing where you can use one therapeutic agent and then treat cancer, it is not really right. We've come to know better. So we look at the third one, disease management and disease reversal.
Right.
Somebody will come and say, what do you mean by disease reversal? Yes, we reverse diabetics. Diabetes can be reversed. Hypertension can be reversed. I was not born diabetes. Is as a result of our lifestyle, especially the type 2 diabetes.
Right.
That diabetes setting. Remember what I had said? What do you mean by lifestyle? Lifestyle covers the diet, lack of exercise, then lack of management of stress. Then exposure to parasites, then sleep deprivation. Tony, I wish you would ask me to expand on what I mean by sleep deprivation. It's a key factor in our health. There is what we call the melatonin cycle.
Right.
There is a particular hour that the sunset has come in. Melatonin is a hormone of sleep. It used to be known as the hormone of sleep. But today we know that melatonin controls several other functions in the body, including anti-inflammatory, it detoxifies, it also immunomodulates our own system. So melatonin is very important. And that cycle starts, the melatonin starts secretion once sun's set.
Right.
Now, if you go up, it peaks secretion at 10 p.m. and it goes up to 12 and then plateaus from by 2 a.m. it starts dropping down. By 4 a.m. melatonin is gone. So if you don't sleep within these hours, no matter what, because it's commonly said you need 7 to 8 hours of sleep. If you don't sleep within these hours, you are not having quality sleep, what we call quality sleep. You are missing your.
Wow.
The fourth arm of this is kind of the palliative one. That's what we call anti-aging medicine. So out of these 4 categories, this is what we focus. Synaptically, immune boosting, disease well-being, disease prevention. Then you have disease management and disease reversal and anti-aging medicine. These are the 4 categories that we do at our place.
Thank you so much. You just shed light on one concept, one thought that I have always known, but you just explained it scientifically right now. You know, many years ago, I learned that the best time to sleep is between 10 p.m. and 1 a.m. That's when you get the best quality, the best health benefits, so to speak, well-being benefit from your sleep. But you have just explained why that is so right now. With melatonin and what have you. Thank you so very much. Now, you gave 4 categories of modalities that you have in your clinic. Now, let me come down to earth. For example, somebody has cancer, or somebody has diabetes, or hypertension, or arthritis, or somebody has maybe dementia, or brain issues, you know, and he walks into your clinic. How do they fit into these 4 modalities?
Very good. The number one thing we do, and let me also explain here a little bit. Integrative medicine, what do you understand by the word integrate? You are integrating, the conventional medicine and functional molecular medicine.
Right.
So when we come to our place, we have different specialties, consultant pulmonologists. We have those in family medicine. We have urologists, we have cardiologists, and we all work because when a case comes, I would like to get their own specialist opinion. But overall, we have to drive the integrative way of doing things. So what is this integrative way? It's very simple, but not easy. In the sense that integrative medicine is not a one-time shot, it's not a quick fix. Most of our protocols are driven for about 90 days. That is when we start attaining or achieving, seeing, results.
Right.
So it is really very important. What do you mean? The number one thing, as we're talking, I can see you wearing a very nice, shirt. So if you are to see my office, it is also clean. That is how the body is supposed to be. But earlier I had said that what invites disease is accumulation of toxins. So one of the first modalities we apply is what we call detoxification.
Okay.
It is very important. We have to remove the toxins out of the body.
Right.
Because if we don't do that, any other thing we are doing is like throwing your gold in the trash can. We will not do that. So we have to just detoxify the individual. And the next thing we do, but let me make it clean. These things are not just done one after the other. They are done in synergy. They are done synergistic. While the individual is being detoxification, he is also undergoing what we call cell membrane optimization or stabilization.
Right.
Now, in our biology in those days, me and you were taught that the center of intelligence of the cell is what? Is the nucleus, right?
Yeah.
But if I have to give you that exam and you tell me nucleus, I will fail you today. Because it is the cell membrane that even directs the activities, sends signals to the nucleus and how to divide and do things through the signal transduction molecules. So, and if you look at so we center on the cell membrane because the cell membrane is really key. We also know that the cell membrane is made up of what we call the essential, fatty acids.
Yeah.
What are the essential fatty acids? Number one is omega-3.
Omega-3.
Number two is alpha lipoic acid. Then you have alpha linoleic acid.
Right.
So this is why in these days you hear people talk about omega-3, 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 because omega-3 is one of the major components of the cell membrane. And why disease came, it was inability of the cell membrane to function properly because of lack of omega-3. So we give what we call omega-3 boosting so that your cell membrane is reboosted. I'm telling you, by the time you start having omega-3 and boosting you see even your skin will start changing. Key among them is vitamin D. The immune system will not function properly. Vitamin D now is actually key. And by the way, vitamin D is not actually a vitamin. Vitamin means vitals and means.
It's actually a hormone.
Yes, it's actually a hormone. Because in the body we have vitamin D receptors.
Right.
So we give you that, so we give the high dose vitamin C to correct. It may also interest you to know, or our audience to know, that 80% or above of the blacks were deficient in vitamin D.
Interesting, despite the tropical sun that we have.
Well, the tropical sun, God Almighty, tried to protect us by making our skin black with melanin. That melanin protects and prevent the absorption of the ultraviolet rays. Then with modified lifestyle, me and you, since morning, how many hours have we actually gone out in the sunshine?
When we go, we carry umbrellas.
We've been in the office from one air-conditioned place to another air-conditioned, place. So we don't even have that sunlight. So we are deficient in vitamin D. So if you look at the scene, that's why with the Caucasians, they can just go on the beach for a few hours, few minutes, they're able to get their vitamin D. But with us, it takes us much longer hours. And then the lack of education. So these are the three things we have to do. Detox, we do cell membrane stabilization with omega-3, and then we do intravenous nutritional infusion so that we can really rebuild the body back and the body starts functioning. If you want to know, our body from the time life actually goes in 3 stages. You have the time of growth, that is what is called the anabolic phase.
That's right.
When we are born, the pH of our body ideally is 7.4. So we grow only for the first 25 years. After 25 years, we don't grow again. The pH remains 7.4. Then from 25 to 40, the pH changes slightly to 7.0. There you see that our activities, and then we were marking our own lifestyle. Then from 40, the pH starts dropping. By the time the pH reaches or drops down to 6.4, that is, death. So you have to, how fast or how soon you go through this, cycle depend on our lifestyle, so that the pH will remain in the alkaline range. We know that once it becomes acidic, that is the environment in which diseases proliferate, the more.
Right. Thank you so much. We've come a long way, even though there are still so many questions to answer. I hope you don't mind if we have part 2 to this conversation, so that we can cover a lot more grounds.
I'll be more than happy. Tony, I most appreciate and applaud your own efforts. I've followed your exposé. By the way, you're just a fantastic, person. God has given you knowledge and you're using it very much.
Thank you so much. Thank you so much. We appreciate. We're going to sign off right now, but before we go, I want you to give us how people may contact your clinic, maybe email address, telephone number, something like that, if anybody wants to contact your clinic.
Okay. One of the easiest ways these days is through our website. We have a fairly robust website that explains all these services and things I've talked about in greater detail. So you go by www.InCountryMedCare, which is the name of www.incountryclinic.com.
Okay.
www.incountry, one word, incountrycare.com. And then if you want to go by telephone numbers, we can also be reached on +234 802 644 1793.
Good.
But the best way is our website, and our email address is just CEO or info@incountry.medicare.com.
Thank you so very much. We'll put it on the screen now. Our technical team will help us put it on the screen so that people can see it and be able to reach out to you. Once again, we thank you for your time. Thank you for the illumination, the explanations. Thank you for, again, choosing to come back to Africa to render these services to Africans. We celebrate you. We appreciate you. And definitely we're going to have part 2 because we have to talk about ozone therapy. We have to talk about undermed. We have to talk about oxygen bar.
Yes.
I mean, if I come to a bar, I'm not expecting to come and drink oxygen. You mentioned oxygen bar. We want to know what is this oxygen bar and what is there for people to benefit. So we'll come back to you. We thank you for accepting to be part of part 2. Thank you very much. So, ladies and gentlemen, this is how far we can go with today's expose. I believe that you've been blessed, and I believe that you have information that can bring transformation. Like I normally say, to be uninformed is to be deformed, but to be informed is to be transformed. Information is for transformation. And with the information you have right now, you can access services and modalities and protocols in the various medical systems available even right here in Nigeria. Thank you very much for your time. Have a very wonderful evening. Bye-bye.